Today's presentation is provided free of charge by the by the Mountain Plains Mental Health Technology Transfer Center and the Great Lakes Mental Health Technology Transfer Center under a cooperative agreement from SAMHSA. Today's presentation is available in the public domain and should not be distributed for a fee without the express written permission of the Mountain Plains MHTTC or Great Lakes MHTTC. The views and opinions expressed during today's presentation are those of our presenters and panelists and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA is intended or should be inferred. Please contact us with any questions you may have. The Technology Transfer Center Network is a national network of training and technical assistance centers serving the needs of mental health, substance use, and prevention providers. Today's training is presented by the Mountain Plains MHTTC and Great Lakes MHTTC, and you can see the different regions and states that we serve. I'm now going to turn things over to Elizabeth for an introduction.
Thank you, David. Hello, everyone, and welcome to today's webinar. My name is Elizabeth Lewin from the American Psychological Association, and I'm joined today by Thomasine Heitkamp from the Mental Health Technology Transfer Center in the Mountain Plains region. APA is excited to be partnering with the MHTTC networks to provide this joint webinar series. APA staff have been talking over the last year to identify ways we can work together to address the behavioral and mental health needs of farmers and how together we can increase awareness among key influential audiences to get more support to the agricultural community. Next slide. In today's presentation, we'll talk about stressors unique to farmers in rural communities, discuss the cultural considerations when it comes to supporting farmers' mental health needs, and offer tools to guide practitioners on addressing the unique aspects of providing mental health services to farmers, ranchers, and their families. Next slide. We hope today's webinar will inspire attendees to work with this population that is so central to sustaining our country. Next slide. Next slide. I would like to now introduce today's panelists, Dr. Christy Phillips and Monica Kramer-McConkey. Dr. Phillips is the chair of APA's Committee on Rural Health and a licensed psychologist and health service provider in Minnesota. She's on the National Register of Health Psychologists. Next slide. Monica has 25 years of experience in the behavioral health field. Growing up on a farm in northwestern Minnesota, she currently works as one of 2 rural mental health specialists in the state, providing support to farmers and their families through a contract with Minnesota Agricultural Centers of Excellence in Farm Business Management. Now, I would like to turn it over to our speakers for today's presentation.
Hi, this is Monica. I'm so happy to be with you all today and excited about spending this next hour together. And I will just go ahead and kick it off. David, if you want to advance. To kick off the presentation today, I think it's really important that we have an understanding of the drive, kind of that unmeasurable innate drive among our farmers and ranchers to continue to farm and ranch. And research has been done by Dr. Michael Roseman, who is a psychologist and a farmer in Iowa. And I really encourage you all to look at some of his research, but he's done research on what he's called the agrarian imperative. And I just pulled a couple of quotes from his different research presentations that he's done, just to really introduce you to this concept. So the first quote, "To farmers, the land is everything. Ownership of a family farm is the triumphant result of the struggles of multiple generations. Losing the family farm is the ultimate loss, bringing shame to the generation that has let down their forebears and dashing the hopes for successors." And as a farm kid myself, and my parents and brothers still farm, and 100% of my time is dedicated to mental health in the agricultural realm, I see this every day, that there is this innate drive to hold on to the land, hold on to the farm, hold on to the legacy despite hardships. And the next quote from Michael Roseman, if we want to advance the slide, is that the agrarian imperative impels farmers to hang on to their land at all costs. It instills farmers to work incredibly hard, endure unusual pain and hardship, and to take uncommon risks. Where we actually see many farmers and or their spouses working off the farm in order to be able to keep working on the farm. So just throwing that in to help kind of set our minds with the complexity of the innate drive that exists within our farmers and ranchers. Okay, David, you can, there you go.
Hi, thanks, Monica. I'm Dr. Christy Phillips. I would like to start by sharing a story that highlights some of the unique challenges of providing therapy for farmers and the farming community. I started working in a rural area many years ago, and it wasn't until 2 or 3 years in that I actually received a referral for my first farmer. One of my colleagues gave me a call one day. She was working in an ER, and one of her patients came in, and he was having all the signs and symptoms of a heart attack. After she ran the panels and did all the tests came back negative. She talked to this farmer about how he might benefit from cognitive behavioral therapy, and went ahead and referred him for individual psychotherapy. The farmer refused. It wasn't until his wife got involved and put her foot down that he agreed to set up an appointment. After I started working with this farmer, it became evident through the cognitive behavioral therapy process that he was internalizing external situations that had nothing to do with him as personal failures. As I worked with more and more farmers, I saw this as a trend. One of the issues that we know about in rural areas is that we have high rates of depression with farmers, high rates of suicide completion. We have, and when a farmer loses his farm, as we have high rates of bankruptcy, they're not just losing their job, they're losing their identity, they're losing their lifestyle, they are losing their home, and they have significant guilt about the losing of a legacy. So it's very intense. And so when we look at stressors, what are those stressors? Right now we're seeing record high rates of farm debt to income ratios. Add to that issues regarding tariffs, the commodities market, unpredictable weather, natural disasters, farmers not being sure that they're going to be able to get help from skilled labor that in the past they've had received from Mexico. Add to this COVID-19, and it's a perfect storm. My farmer clients are describing it like carrying a huge boulder on their back that never comes off, and it affects every aspect of their life. Farmers know about rural resilience. It's in their blood. When we talk about heavy workloads, it's always been there. So you add all these additional stressors, and the burnout rate can be significant. But farmers, they're not allowed to burn out. It's going to be something that happens medically. They tend to deprioritize their own medical and mental health to get that job done. In terms of social isolation, this is a concept that I think can be easily misunderstood. Social isolation, many farmers are driven to become farmers because they have a strong sense of working independently, and that's something that appeals to them. But there is a double-edged sword to this, that there's a dark side. And so social isolation doesn't have anything to do with how many people you have surrounding you. You can have a large family and be interacting with people on a regular basis. It has to do with the quality of the relationship. Do you have people in your life that you can actually share your inner life struggles with? Can they understand what you're going through? So for many farmers, they're a very tight-knit community, and they're able to get together during times when it's not busy season or harvest, early morning coffees, going to farm auctions, ag-related events, volunteering in organizations in their community, being part of their faith communities or churches. And that's oftentimes a protective barrier to help support farmers. Next slide, please.
So just a couple additional farming and ranching stressors that I see when I'm out and about on the farms and working with farmers. Farmers as an occupational group have a very, very high rate of injury and death due to work on the farm. Farm youth have a very, very high rate of injury and death. And we all know the impact that stress plays on potential safety issues. So in times of high stress, in times of time constraints, when emotions are running high, we're less apt to pay attention to safety measures. And so injuries happen. On the same hand, the illnesses are very common in farming occupations for a variety of reasons: the physical demands, the stress, the environment sometimes that people are working in. And as Christy mentioned, it's not like farmers can take PTO and take a week off to get better and then go back to work and still receive payment. It doesn't work that way. Which leads into my next point, is really the irregular and uncertain income that the families face, with some months being really high with expenses and no income coming in, and then other months, maybe when commodities are sold or livestock is sold, there might be kind of a huge amount of income coming in that really needs to be budgeted over the course of a year. And then a final point on additional ranching and farming stressors is that our farmers, the average age of our farmer is creeping up to about 60. And so with that being said, the focus is on the future. Who's going to be taking over the farm? Who's next in line? Is there anyone next in line? Are there people next in line and the parents are saying, nope, when we're done, everything's being sold, land's being rented, you're not going through the stress that we did. So a lot of very stressful issues around transition and succession planning that often involve communication breakdown and relationships with in-laws that are often strained. Okay, next slide.
So let's add COVID-19 into the mix, and it is the perfect storm. Many farmers and farm family members tend to have off-farm jobs to provide for their health insurance and also other financial needs of the farming business. During this time of COVID-19, many of those jobs have been lost. And so that has led to additional concerns about the financial impact and just getting services in general. Even those, even people who are able to continue on with their insurance, they're worried, are we gonna have these jobs in the future? And what does that mean? Does that mean that we're going to sell off some of our land or sell off aspects of our business? So it adds to that additional worry. Social isolation, I talked about that earlier. Some of those protective pieces are no longer there during this time of COVID-19. So farmers are being isolated from the very people that in the past they could feel validated by and get inspiration from. They're no longer having those early morning coffee sessions with the farmers. The auctions have been closed down. They have, like, churches were not meeting in person. And so it has added additional stressors. Family stress. It's not uncommon for farm families to live in an intergenerational way on the family land. So there might be grandparents in a house, parents, grandkids. And as much as we all love family closeness, we know that there can be generational differences. And it's nice to be able to have some restorative activities to get away from that. We were not seeing that during COVID-19 with the school closures, with daycare closures, with elder care closures, or people that were coming in to help with elder care no longer coming in to provide supports due to the COVID-19. The farm, still the duties have to go on. And so we put on extra stressors, trying to homeschool, trying to adjust to having family members around at all times. Not to mention some political divides between the generation on how to handle and manage COVID-19. All of this added to the stressors of our farmers and within our farmer communities. Next slide.
For the next couple minutes, I'm going to spend just a bit of time talking about warning signs that we see commonly among farmers. And just a little caveat, when I say farmer, when Christy and I are talking about farmers, we're talking about farmers, ranchers, female farmers, you know, the whole, that's just kind of the general term we're using. So please know that we're being inclusive, even though we're just stating farmers. So when I say warning signs, these are pieces of information that those around the farmer may see. And so when I talk to ag industry groups or to other mental health professionals, these are all signs that some are very unique to farmers that they may not pick up on right away without having that background relationship with them. So we'll just run through these. Some are very general, of course. Any change from baseline functioning we know is a time to really pay attention and find out what's going on. But obviously mood changes. If we're seeing abrupt sales of land or livestock or equipment that it didn't really seem that was really in the plan for the future strategy of the farm, that's a huge red flag. I got a call one day from a lady who, they were beef ranchers, and she overheard her husband on the phone telling whoever he was talking to that they were going to be selling their entire herd of beef. And she was like, what is going on? They weren't ready to be done. This was news to her. He had been depressed and had been having difficulty getting out and getting the chores done. And so she automatically was really worried about that abrupt sale having deeper meaning of hopelessness, potentially some suicidal ideation. So we, based on that, overhearing that phone call, we were able to intervene. Also along those same lines, disrepair. So if the farmstead or the ranch is typically in good repair, neat and clean, equipment is kept up, fence lines are kept up, and suddenly you're seeing a change from that. So maybe there's equipment kind of parked willy-nilly all over, and that wasn't the way it was before. Maybe livestock are even exhibiting some signs of decline. And I'll give you an example of that. I was at a farm several months ago, and this gentleman was a dairy farmer, had been for years. And when I drove onto his farm, I just knew something wasn't good, because there was equipment kind of parked all over, some in various stages of repair, some half filled with grain. I mean, it was like incomplete jobs all over the place, okay? So he was in the barn, and I went out to the barn to meet with him, and we stood next to the bulk tank where they store the milk for 3 hours. He talked for 3 hours, and not once did he offer to bring me in and see his cows, which I'm a farm girl, showed cattle in 4-H. I love that stuff. And he said something that I thought was so insightful. He said, you know, years ago, my herd was one of the best producing herds in the country, in the county, the best milk producing herds. And he said, today, they are a direct reflection on how I'm functioning. So he had been coping with increased substance use. He had been missing milkings, which is huge for dairy, and just not getting outside, not getting up. As a result, production was plummeting. So when there's not enough money for production, you're not feeding the cattle the way you should, which further perpetuates a downfall in production. You know, the veterinarian isn't called out like it should be to keep up the health of the animals. So it gets into this vicious decline, this vicious cycle. So those are all clues that if this isn't typically how the farm was run, and we're starting to see this decline, definitely red flags. Injury and illness I talked about previously, altered sleep patterns. This is huge, and this is what drives a lot of our farmers to actually go in and see somebody, typically a primary care provider, is that they're not sleeping, and so they're experiencing the effects of that. I would say 99% of the farmers I work with and their spouses are not getting good sleep. Increased substance use, we talked about that. If this was somebody who, you know, maybe they went to the bar after work and had a few beers before they went home, but now, you know what, they shouldn't even be driving home from the bar, or maybe they're sitting home alone now, and that social aspect has been removed. So that's another red flag. We also see increased opiate use, especially given the farm-related injuries and the pain medications that have been prescribed. It's not uncommon. A general lack of motivation, unpaid bills, and just feelings of hopelessness, that sense of, I can't do this anymore. And I hear that from farmers, and they'll say, I can't do this anymore. This isn't working anymore. General comments like that, which could mean a lot of things. Can you not farm anymore? Are you saying you can't milk anymore? Are you saying you can't be in this relationship anymore? Or are you saying you can't live anymore? So it takes some conversation to find out what that hopelessness really means. Okay, next slide. So when I work with farmers, I really work on a holistic approach, and Christy will be getting into this in a little more detail with her slides coming up. But I definitely look at what protective factors they currently have, and how do we build those that are lacking or where there's gaps. So biophysical, are they sleeping, eating, drinking something other than coffee, pop, we say here, soda, energy drinks, alcohol, things like that, eating healthy. So their physical health, are they taking medication as prescribed? Are they seeing the doctor for things they need to be seeing the doctor for? And then psychological protective factors, how are they handling their emotions and their thinking? Social, Christy alluded to, it's been tough. I had a female rancher text me during the kind of the midst of the shutdown when we were a month or two in, and she said, if you have any influence with the state, we are drowning out here. We at least need to be able to go to church. And there was that desperation in her voice. So the social aspect, do they have people to talk to? Do they have a support system? And then spiritual, our farmers are typically very faith-based people, and however that plays out in their spiritual life. But to put a seed in the ground and trust that it will produce, trust that the weather will cooperate, trust that prices will be there, and they do this year after year after year, there is a very strong element of faith that can be a very good protective factor if nurtured. Okay, next slide. So we'll spend the next few slides really addressing barriers to serving our farmers and ranchers. And these are things I hear from them and run into all the time. The first of which is expense. Right now, with commodity markets being what they've been for the last really 7 years or so, we have farmers who can't afford. We have farmers producing thousands of pounds of food, and they are going to the food shelf to be able to feed their families. So something is just not working there. So to have a farmer rancher seek help, expense may well be a barrier that keeps them from coming into the office. Along with that, insurance, if our farmers have insurance, the deductibles and co-pays are often very, very high, so they're not able to afford coming in. In many farm couples, one spouse works off the farm strictly for insurance purposes, and that's another webinar, is really around those farm couple relationships and how that all plays out. Okay, next slide. Another barrier is time and seasonal workload demands. So it's really important that you are aware of the agriculture economy in your area. What are they growing? When are the busy seasons? When I see farmers and I have the opportunity to go right to them or to their farms, you know, during spring's work, I may be out at a farm from 8 to 10 at night because they are going from 5:30 in the morning until 8 at night at least. And so they are definitely barriers when you're wanting to work with them on coming into the office or coming in to meet with you or scheduling an appointment. Okay, next slide.
Thanks, Monica. One of the farmers in general are reluctant to seek mental health services. The perceived and real stigma in rural areas. Farmers are worried about their confidentiality, anonymity. If you've ever been into a clinic, I live in a town of 800, and if you've ever been into a clinic waiting room, sometimes it is the most social area that you can imagine. When I come down to the lobby to pick up a patient, it takes me a while to break them away because they haven't seen people for, you know, some time. And so it's very difficult at times to to keep that confidentiality, because oftentimes the first thing someone would say is, "So what are you here for?" And so many times it's difficult just to get a farmer into a clinic in a rural area. The other piece of it is that I've had farmers talk to me about, you know, if someone sees me, they're going to look at me like there's something really wrong with me if I can't do this on my own, that I have real problems. And so I think we all can do much better as a society to start talking about mental health, just like we would our medical health or physical health. The brain is just another organ. And so why we're still at this point where we're not all talking about it, it's baffling. And so if there's one thing that I hope that we all can do is start talking about our feelings. When we ask when I tend to initially see a farmer and I ask them about stress, he or she will start talking about external stressors, the weather. They will talk about commodities, the pricing, but it takes several sessions before I can really get to how are you feeling? What are you really thinking about? And so I think it's something that I would love for people to take away and start right away. Talk about how you're feeling, not just what the stressors are. Next slide. So how do we start those conversations? So often people just don't, because they don't want to say something wrong, and they're afraid because sometimes it feels like farmers have so much on their mind, especially during busier seasons or harvest, that they don't want to add anything by talking with them. That's not helpful. Let's start the conversation. So the first thing that I would suggest is just acknowledge that, you know, here the COVID-19 has been making it really challenging on the farm. How are you doing? Remind the farmer of it, something that they said to you. Maybe they said they were seeing the banker this last week. You know, you told me you were going to go see the banker. How did it go? Share, as Monica was talking earlier, you know, don't be afraid to mention what you're seeing. A lot of times people don't know that, you know, what their own behavior changes are. You might share something like, hey, I've noticed on the last 2 Zoom coffee breaks, you haven't attended. How are you doing? Initiate. Don't wait for a loved one or a family member who's a farmer to come up and start talking to you. Initiate a conversation, and it can be as simply as saying, just want to check in. How you doing? And then encourage. At the end of today's webinar, people put a great amount of time to try to put as many resources that we can that could be helpful to everyone and farmers and farmer families. So maybe look at some of those, have one in your back pocket. So if you are a person that a farmer or a farmer family member feels comfortable talking to, ask them, you know, hey, I saw this a website that I think might be really helpful information. Would you like me to send the link? And then if they would, send it, follow up. Next slide.
One of the really important pieces to working with farmers and ranchers is to become, and I like to call it, agriculturally competent, right? We all, as helping professionals, have areas where we need to have CEUs and have education in different areas of cultural competence. Well, agriculture is really its own cultural competence category, if you will. So people working in rural, ag-rich areas become familiar with what commodities are grown in your area, what types of farming are happening in your area, and what are the economics around that. And then more importantly even than that is what resources are handy, because I'll get calls from farmers where, you know, I can work with them on the emotional side of things, on more productive thinking and things like that, but they really need somebody who's going to walk with them through mediation with the bank, or they need somebody who's going to help lead them through successfully transition planning with their family. So there's, you know, we can talk about a lot of those things, but the expertise, there are programs out there. So really be inquisitive, I guess, in your region and in your state about ag resources. And there are simple places to look, like your state's Department of Ag website, your state's extension, University Extension website are both great places to start. Okay, next slide.
So what type of treatment and resources do we want to think about for farmers? If there was a silver lining with the COVID-19, it's telehealth. It's too bad it took us a pandemic to get up and rolling and competent with this, but this has been life-changing for our farmers. If you think about the geography out in our rural area, I've had farmers drive 2 hours each way when it wasn't busy season or harvest to come to a session. Well, that's impossible during harvest. And to be able to have telehealth when it's needed, and it could even happen during harvest now, during times when the stressors are incredibly high, has been invaluable for our farmers. Telehealth has, we know that 4 out of 5 Americans own a smartphone, and so this is something that needs to be a continued resource for our rural areas. Telehealth has been quite interesting as a psychologist. My daughter's told me not to tell this story, but I'm going to tell it. Finding spaces for telehealth has been interesting. I never thought I would see a 13-year-old's bedroom, and some, you find out collateral information that you never thought you would know. But I can tell him that this particular client was complaining that his grandma was always on his case about the mess. Well, grandma actually was right. And so being able to see, the actual homes of where people are living, it also has shown me just again about some of the stigma. I had a client that I had seen a few weeks back that I've been seeing off and on for a few years. And she said to me, if I close the top of my laptop, it's because someone may come in. And it was evident that she has never told anybody she's seeing a psychologist. And so those are that's the types of collateral information that is rich, that you get when you are utilizing telehealth. The other piece to telehealth that I think has really been helpful is people can use their smartphones and drive somewhere and get that privacy. They don't have to worry about those confidentiality issues and anonymity. And, when we deliver telehealth, one of the first questions is, where are you? Well, sometimes that gets to be a little challenging. So once we can figure out where that barn is located and where that county road is, then we're good to go. But there definitely are some challenges, but worth having those challenges to get those services to our farmers when they need it. We've talked quite a bit about communicating to opening up communication with farmers, but we also need to look at risk assessment. There's a difference between, people talking about, considering suicide or considering not continuing on with their lives. And that is so important to open up that dialogue, get people set up with a psychologist or a therapist. This is the best time to do that with telehealth. But if it rises to a level of, now I have an intent and a plan, we have to not, let our uncomfortability take over. Just like if someone was having a heart attack out on the land, you wouldn't say, they'll probably feel better tomorrow. We get them the help they need. So they need to get to a hospital, emergency department, a crisis center. We're really fortunate out in my area in Minnesota to have a crisis mobile unit that can come right out to homes. That has made all of the difference. So continuing to come up with innovative programs that are going to be helpful for our farmers and our farming community. Cognitive behavioral therapy, as I opened with today's presentation, I have found in my own practice to be extremely helpful. There are generational trends that have been passed down in terms of what it means to go it alone and to not share your struggles and to pull yourself up by your bootstraps and make this thing happen. And if we can work with people on challenging some of those cognitions, distortions, past schemas, then they can start seeing they have many other options. And so that's just one modality. But I can tell you that there's hundreds of modalities out there, but the reality is we're dealing with human beings. And what's going to be most important is that you establish that relationship of trust and that they know when they leave you that you're thinking the same thing as when you're in the session. So there's a genuine therapeutic relationship there. And it helps to be able to share that, my grandparents had a farm and we just went through that whole having to sell the farm and what that did with families. So share your personal experiences when they're going to be helpful therapeutically. I'm going to end today's session with a story that I found really impactful. It's a story that was related by Viktor Frankl, a famous psychiatrist and neurologist. He shares a story that a woman called him in the middle of the night, calmly sharing with him that she planned to take her own life. Frankel kept her on the phone, and he listened to her depression symptoms, her anxiety, her feelings of loneliness, her feelings of social isolation is the term we'd use today. And he gave her reason after reason after reason to just stay around one more night or to continue living. And after he felt that she was safe and that she convinced him that she wasn't going to harm herself, and she kept her promise, they ended up meeting the next day. And Frankel asked her, what reason, why did you decide that you weren't going to consider suicide as an option? Was it when I said this? Was it when I said that? Was it this? And she said, no, it wasn't any of those things. And he pushed and said, so why have you decided that you're not going to harm yourself? And she said to him, a world in which somebody was willing to listen to me and take the time out to care and to talk about, the problems I'm having, was a world in which I felt that I wanted to stay in. So I say this example as sometimes the most important gift is the gift of being there for someone and listening. It's not the brilliant argument. It's not the turf wars over what modality is going to work better than another, but it's that simple gift of listening, and we can all do that. We can't afford to lose any more of our farmers, so let's make sure that we're all listening. Thank you.
Thanks so much, Monica and Christy. What a wonderful presentation. We felt your energy and your commitment. My name is Thomasine Heitkamp, and I'm with the Mental Health Technology Transfer Center in Region 8, which is the Mountain Plains Center. And we're pleased to host this with our sister project out of the Great Lakes and APA. And we have a great selection of questions that are coming through in the Q&A box and questions in the chat box, with almost 600 people on our series today. But one theme that I'm seeing is the issue of engaging farmers and some questions about children and their family. How do we keep farmers engaged and recognizing their stigma, recognizing there's kind of a tough mentality around receiving behavioral health services? So if both of you could maybe say a little about engagement and specific strategies you have used, maybe starting with Monica and then moving to Christy, please.
Sure. So once I have a referral and I've met with a farmer or a farm couple, as you all know, a lot of times those calls come in moments of crisis. And so what is not so abnormal is that we have a session or 2 sessions or a phone call or 2 phone calls, the crisis fades, and so then it's kind of back to life as normal. And I think that's typical in therapy overall, that people seek out help in the heat of the moment and then tend to go back to life until the next crisis hits. So one thing that I do is I check in with my farmers, and I'll, depending on their preferred mode of communication, I'll shoot them a text. How are you doing? Just a reminder, I'm here if you need to talk, you can call, or I'll call them and just check in. How's it going? Last time I talked, you were dealing with this. I'm just, you were on my mind and I just wanted to check in. And oftentimes that reach out draws them back in, and so we can talk some more about what went well, and I can give them a lot of positive feedback about implementing strategies, or what didn't go well, so what maybe do we need to change a little bit. So for me, that reach out piece has been really valuable.
Thanks, Monica. So I think we need 100 Monica's cloned. Getting out to farmers where they're at, and how coming up with innovative ideas to do that. I also think that, when we're looking at, when you mentioned children, we're looking at the younger generations, hitting them where they're at in terms of utilizing smartphone apps, working with them on checking in ways that they can learn easily. Sometimes we don't give the credit to some of our younger clients in terms of how they can access these types of online apps that are evidence-based, research-based in terms of making sure that they're safe and that the information is going to be utilized in the way that we'd want it to be utilized. So I'd recommend, if you haven't had a chance to look at our APA site with some of the research-based apps that we've looked at, so that people can know to utilize those to stretch out time between session and still work on some of the issues, and whether it's working on breathing techniques, meditation, or challenging negative thoughts. There's so much out there that could be helpful for people. And the other area that I think about is just that looking at new models on how we deliver service. You know, we know that many farmers are getting together at those auctions or coffee hours. You know, if they can get to know you as a person and see if you can get invited, you know, find out, do some of the types of things that Monica is doing, and let's not assume that the research applies to them, because every area is incredibly unique in what those stressors are and what can be helpful. And so that communication piece is key. And so continuing to look at innovative ways of joining with our farmers.
Thanks, Christy and Monica, for the response to that question. And at the end of this slide deck, you will see a host of resources that will be available. And David is putting in the chat box and the Q&A box a link to the slides that are already up on our webpage, so you can grab those and see those resources. Another question, and Christy Nelson brings us this question. Do you know of any nationwide virtual mental health services and or crisis helplines specifically for farmers, since they experience unique risk factors compared to the general population? So maybe we'll start with Christy this time in terms of if you see those risk factors around crisis and how you're dealing with that, and any kinds of supports.
Yeah, absolutely. You know, there is the farmer hotline, and maybe Monica could speak more to this. However, you know, yes, farmers have specific needs, but when it comes down to getting help for any type of suicide prevention, you know, we all bleed when we get cut. We want to just get services right away to farmers. And so I would suggest always going straight to the local services, emergency department, if you have any concerns at all, but the National Suicide Prevention Lifeline. And then they can also help direct you. So many of these types of resources that we have at the end of our presentation, even if it's not specific, once you contact those prevention lifelines and helplines, they can help you. And I really recommend that people test it out, because before I give out a number like that to a client, right in session, I'll say, let's try the online text line, or let's try the National Suicide Prevention Line, to make sure everybody's comfortable with it, that there's not a typo. But also, if you have somebody that you love and know in the farming community that you're starting to wonder about, test that out first, ask a few questions, get comfortable with it, so that if it is needed, you're ready to be helpful.
Just briefly tacking on to that, most states do have some type of dedicated farm stress hotline or helpline. And so it's really looking at what does your state have. In South Dakota, Avera has a helpline designated for farm stress. In Minnesota, there's a Minnesota Department of Ag Farm and Rural Helpline. I know other states have those as well. So it's really looking, but I agree with Christy that if it's a crisis, it's a crisis, and access what emergency services are available, whether or not they're specifically for farm related. And just if I could tack on 30 seconds to the last question that kind of ties in with this question, if you're in a organization or agency that wants to reach out to farmers, one really great way to do that is to partner with ag industry people or ag industry organizations, because that's where farmers are. If you have an event that's titled anything to do with stress or mental health, they will not come. Farmers won't come to that, really. They will come though if the meeting is about crop insurance or the farm bill or the markets or some update or some training around chemical or pesticides or whatever. And then that ag industry slips in a piece on stress or mental health. I do that all the time in the state and across the country. And that's where you get your direct farmer audience. And sponsor it, throw in, have your organization sponsor the lunch or the dinner or the giveaways or whatever the case may be. But it's really reaching the farmers where they're at to make them aware of the services you offer.
One of the suggestions in the box was a potluck. And building off this in terms of themes, there is a question about work on succession planning with farmers and supports that they might have financially to work on succession planning. So I don't know who wants to start with that, but I thought it was an important question.
Most extension, state university extension agencies do have some programs around succession or transition planning that works with the family to kind of map it out, or they offer classes. Some places have like a weekend or an overnight retreat. That can get really heated because you got the whole family there working through their transition issues. But it's what needs to be done, and it's guiding them in that communication. So again, really check into your ag support services, your extension services, and see what programs are out there in your state for succession and transition help.
I was just going to say, Monica, I hear that in sessions where, because of this debt to income ratio being so high, I hear the next generation that's going to take over the farm. They're saying, nobody's talking about all this debt. I'm going to take it on, and then I'm going to be the failure. And I'm so stressed out about this, but nobody's willing to talk about it. So that is invaluable to start that conversation, because it is something that I'm really starting to hear as a trend in sessions with that next generation of farmers.
Thank you so much, Monica and Christy. And I think if we were in a big lecture hall or presentation, there would be a round of applause for both of you because of this excellent work. And you probably didn't see the chat box, but lots of comments that you nailed it, and that these participants get your sense of commitment to working with farm families. And there was a question about working with children, and I think your example, Christy, of your work with a 13-year-old really hit on some of those issues, as well as not to forget about the farm family. And we have good news. American Psychological Association and Mental Health Technology Transfer Centers, this is the first of a 3-part series. David will be putting the other registration for the series. We will be doing something on co-occurring disorders, and we will be doing something on telehealth. We hope that all of you who joined us today will return for the next series, and look forward to you joining us for other sessions. Thanks so much.